which I think we are. So I don't know if we can move to one of the first slides. So we'll get started. I know everybody's busy here with a lot going on, and I think we want to try to get to a lot of the information that we got prepared on the webinar today. I did want to say just thank you for everybody for joining us today. On this call, we've got people listening in from all across our community. We actually have patients, families, researchers, clinicians, and companies, which are, represent our community. This is what we always are, one community with all of us working together to support each other. So thank you for joining us. Thank you, everybody, as well, for what you're doing right now to help our community, support our community, and keep it strong. We did just want to kick things off by saying we're here for everybody during this time. We're doing everything that we can to make sure that every single family, every single patient in this community stays safe and stays strong. That's what we're doing. We're very much focused on that. I think as well, what we're seeing is that the situation that we're dealing with is something which the SMA community as a whole knows how to deal with. This is a situation, I think, where the community is really set up very well after going through kind of the flu season, quarantine, self-isolation every year, that this is a community that's set up to know what to do right now. And we're going to focus very much on keeping everybody safe as we go through this. We wanted to say as well that we, Cure SMA, we're here to support anybody and everybody in this community at this time. We're very active right now in setting up new programs to deal with this issue, but we're also very active on an advocacy front, and we're looking at things at the national, federal level, and then all the way down to the state level and personal issues as well. And so we did want to say, please reach out to us, let us know about situations that you have in your local area, in your state, where we can get involved and help out. Please reach out to us, let us know. And we'll get involved in those issues and support, again, every single family, every single patient in the community. One other item I just wanted to mention before we kick things off is I think the community, we are very well set up to deal with this. Some of the ways that we deal with, again, the flu season, but also our approach, our advocacy, the way that we support each other, we're very well set up to come through this, deal with this issue, and keep everybody safe and healthy. We, as I was saying, are very well set up. People know the quarantine protocols. You're the world's masters in the social distancing and staying safe. And so that's going to help us through this situation. We're also a community that is very good at the advocacy side, which is going to be important as we go through some of the issues that are coming up. And so the way that this community speaks with one voice in a very positive, very effective way on advocacy issues is going to be very important and help us through this situation as well. Another item that we have known to be very important in the past and is going to be critical now as well is the importance of timing to treatment, getting on treatments, and the critical nature of timing there and how important that is. We also are a community that is very good at supporting each other, and that's already kind of bearing out, and we're seeing that where the community is very good at sharing information, protocols, precautions, knowledge. That's going to see us safe as well. That's going to really help us through the situation. I think as well, another angle is that this community is very good at speaking with one voice, but also bearing in mind individual personal situations, personal choices and decisions that have to be made, and supporting those decisions as well. And so that's going to see us through this. We're really well set up to deal with this situation. So we want to go to some of the next slides. I did want to say as we go on, we do have a website that we set up, a main page that is going to bring together all of the information and the resources that we are pulling together right now, new support programs, advocacy initiatives, and there's a main web page on our website where people can go to get all that information. And so if you want to go to the next slide. I'm going to tee things up with a few slides of the general topics that we're going to focus on the webinar here today. But then we're going to have Mary Schroth, our Chief Medical Officer, focus for a lot of this webinar on the medical issues specific to SMA dealing with COVID-19. We're also going to have Colleen talk about our support programs. And then we have Maynard on, who's going to talk about these advocacy efforts that we have going on. I wanted to start off just with giving people an update on where we currently stand and the actions that we've already taken. One thing that hopefully you've all seen us do is take some action with the in-person physical events and activities that we have going on in the community. And so we've gone through and we've looked at all the in-person events from March all the way through to May, and those are being canceled. We're currently at a position where next we're going to be looking at the June events, summits and walks, and then critically the conference as well. We know all of these events are very important. They're really important for us as a community to keep us together, to advance research. And so they're very important to us, but I think some of these choices are very easy when we're going to make sure that we're not going to put any single patient or family at risk. And one thing I think we've been doing is going above and beyond some of the general recommendations that are put out for the general population on distancing, numbers of groups, and how long that's going to last. We're going to go further. We're going to go above and beyond on making sure that we keep everybody safe. And so we will be making a decision, and you will see announcements and information from us about the conference and those few June events probably within the next 2 weeks. It's a big decision. We're really looking at it very carefully, but we know as well we've got to get that out to the community in advance. There's a lot of work that goes into the conference. So expect some information and a final decision from us within 2 weeks, especially about the conference. The other angle as well that I wanted to reiterate, I said it a few times, you're probably going to hear it throughout, is that the approach that the SMA takes to dealing with the flu season, dealing with infections, the way that this whole community is set up is what we need to keep doing. So following the usual SMA hygiene approaches, what everybody normally does in shutting things down, going into full quarantine and isolation during flu season is what we need to be doing now. And it really seems like pretty much all the community is currently doing that. It seems like a lot of the community as well was already in that mode, that mindset from the flu season and just kept it going. We know it's difficult, but this community is set up better than anybody else to follow that through. I think as well, what we're seeing from that, this is what we think the situation is, that we haven't seen a big impact from COVID-19 into and directly on the SMA community as of the current time. We've heard of a few cases, but very limited. But our take on that is not that an SMA patient has some kind of special resistance or special immunity, that there's no special way to kind of respond better to COVID-19. We don't think that's the case. What we think is what's causing very limited impact right now is that everybody's shut down, that you know what to do, that you're already set up into the quarantine procedures that are now getting rolled out into the general population. So that's our mindset. And so from that, what we want to say is everybody still needs to maintain very high vigilance. You need to do what you've all been doing, probably longer than the general guidelines are going to be out there for the general population, and keep a very high focus on those general processes and protocols, procedures that you normally do. Keep those going. That'll see us through this. We also know that this is a difficult time in finding information and knowing what's accurate. Mary's going to get into a lot of this, and we'll do the best we can to put accurate information out. Try, if we see misinformation, to correct that as well. And we'll be doing a lot of active communication over the next couple of weeks and months to give you the right and accurate information as best we can. So if we want to go to the next slide. So one of the topics I wanted to highlight and give a focus on is this aspect that is unique to us in SMA right now of the treatments that we have, and how that needs to be looked at this time with COVID-19 going around as well. And so we've always known this in SMA, that the time to getting onto a treatment, the time for getting doses, keeping doses going is very important. It's always the sooner the better in SMA that we want to get onto treatments. What we do want to say is that generally people should be looking to follow through on doses if they're scheduled, with Spinraza mostly there, or getting started up on a treatment. People aren't on treatment yet, and if they're looking and they get into the final stages of starting up, whether again it's with Spinraza into the loading doses or onto Zolgensma for the infusion, generally you want to be looking to follow through on those. We have already put statements out. We've been very active in this to the community and broader, again, some of our broad advocacy initiatives to make sure that these treatments are not looked at as elective. They are essential. They're life-saving. And so we want to make sure that that message is out there. However, we do in this time now have a little bit of a different approach than in a normal circumstances. What we do want to say is that some short-term flexibility on timing is warranted, and I think in certain situations is something that people will want to look at and take that into account. That what we're really saying here is if you're looking at the timing of a dose, timing of getting on treatment, weeks of, flexibility there, pushing things back a few weeks is not going to matter when you look at some of the other risks that are going out. We are saying that shouldn't go into months, that delaying things by a few months is not the best thing to do, even if there's some other kind of risks that are out there, that months are going to start to cause issues if you're waiting that long and you're looking at the declines that do come in with SMA. So this is our general guidance, that weeks are okay to be flexible. If you've got to kind of reschedule something by 1, 2, 3 weeks, that's okay. But if you do start getting into a month and beyond, that's when we need to kind of really look at the situation and step in. Here, what we're really saying is that, again, in normal circumstances, normal situation, no, you want to get it right away. But there's a personal angle here that should be kind of weighed up. And this is where your personal situation, you're going to have to look at this. And I think what we're saying is, if in your personal situation that your health status is a little compromised, if you're just getting over a cold, if you're run down, if you're getting through a sickness recently, your immunity may be at a lower level generally. That's something that may cause you to want to delay getting a dose by a few weeks so that you get your strength back up. I think as well, in addition to that, it's also looking at the personal location where somebody is. I think we're all seeing that there's certain areas of the country which have very high cases, very high infections. That's going to be very present at hospitals. And that as well could be a factor that says it may be better to wait a couple of weeks. So it's this balance of the risk there. There's a risk that'll increase if you start waiting months, but there's a risk in the short term if your health status is low, if you're in an area with a lot of infections that may cause you to say it's best to wait a little bit here. Let your health status improve a little bit. Let things calm down a little bit in your particular area, in your hospitals, so that balance is correct. We'll say a little bit more about this as well, and Mary will get into it. But a few other little caveats on this angle as well. I think some of the different areas to look at are, if you're looking at getting started on Spinraza, you've obviously got the loading dose period there. And that's something where you're going in quite frequently. And you want to think about that part and kind of set things up and schedule that you've got to know that you're going to be going in there very regularly in a short period of time. Prepare for that, get ready. That is something where you don't really want to stop in the middle of that loading dose period. You've got to get those loading doses in on time. It's the maintenance doses where you've got this extra flexibility of a few weeks on the doses. With Zolgensma, I think one of the other issues there to look at and pay careful attention to, be extra vigilant, and Mary will get into this, is some of the procedures that go around getting the infusion just before and then the months kind of afterwards with tapering on prednisone and things like that you've got to pay extra attention. You're going to have to go above and beyond even some of the normal procedures for that time. Again, there, I think you will want to get on treatment as soon as possible when you're starting, but be prepared for those two kind of issues with Spinraza and then Zolgensma as well. One of the reasons I think we can get into more detail of why we look at this kind of flexibility of weeks with Spinraza. Again, we're not talking beyond a month, but in weeks this is something which stays in the body for a long time. This is why there's that scheduling of months between the maintenance doses. And so the level of the drug in the body actually goes down very slowly. It can be almost around 4 to 6 months before you reach this half-life point, which is where the level of the drug in the spinal cord in particular has gone down half from where it initially stood with a dose. Now, that isn't saying you want to wait 4 to 6 months at all. That's when it's gone down by half, and you need to keep the dosing at a high level to get the maximum effect. But hopefully what this explains is why it goes down very slowly. And just over a couple of weeks, what we're saying is an okay kind of timeline to look at. The level of drug has not dropped down that much. And that's fair in this situation to balance if you've got, again, those risks of your own health status and your own location. Two other areas we just wanted to kind of focus on are looking at the regulatory approach. We know we've got some things in the works with the FDA right now. We are approaching this where we know the FDA is strained to the max right now with what they have going on with COVID-19. They also are dealing with, as you know, their own processes going remotely. I think we're very much focused and working with sponsors as well to make sure that the timelines that we're looking at for approval stay there. We have that PDUFA date out there. I think our main goal is now to try to make sure that PDUFA date stays, and we do all we can, the sponsor does, and the FDA is working with us as well to try to make sure that we kind of hit that timeline. We don't have any information one way or the other, but that's our focus, meet that PDUFA date on the regulatory side. With clinical trials, I think what we would say here is there's a number of clinical trials going on. There might be some new ones that start up as well. These are important, but some different angles come in here when you're talking about clinical trials with the current situation going on. Obviously, we talk about these all the time, and even kind of the EAP programs that might be out there as well. These are important. They're not the key way to get access to a therapy, but they're very important for the people that get into those clinical trials and the community as a whole. What we're seeing from and hearing from sponsors, clinicians, and the FDA as well is one of the things in clinical trials a little differently from treatment is you're often going to be going back into the hospital setting for follow-up visits and monitoring. But that's somewhere where during this time, you want to look for flexibility. And it's actually something that sponsors, clinicians, and the FDA have already put into place, that there's added flexibility during this time to look for alternative ways than going in for a hospital visit to do these follow-ups and maintenance. Looking at doing those remotely, virtually, telemedicine, and that flexibility, I think, is being built in now. And it's something that should be there, and make sure that you look at that angle as well to reduce some of the visits into the hospital setting. So we want to go to the next slide. This is an area that Colleen is going to talk about quite a bit with how we're looking at our programming. And we're looking at it in two areas. And one certainly is for the programs that we're getting canceled right now, we're looking at how we replace those. How do we change from the in-person events to doing things virtually? Things that we've always done, and we're trying to make sure that we're getting the information that we always put out there, but new opportunities as well. So some of the things that we're going to be having in place, looking to do virtual sessions, hopefully to focus on physical therapy. How do we keep that going during this time? That's very important for the community, leveraging the treatments. We need to keep that going. We're going to be holding a special webinar for newly diagnosed families, making sure that they get accurate information, but more importantly as well, that they get trained up very quickly on these precautionary measures that the rest of the community knows. Make sure that they realize how critically important the quarantine self-isolation is generally in SMA, and especially now. We're also doing a webinar for healthcare providers. We have a lot on this call, but we'll be doing a special webinar for that group as well, giving information and sharing information across all of the healthcare providers that are focused on SMA right now as well. And also we're going to be looking at not just information and the practical side, but making sure that we as a community socially stay together and stay together strong. So we're going to be putting some platforms and tools in place that allow chats, hangouts, and things like that. And we'll be getting that going for the community as well. What we are, though, very focused on is, in addition to replacing what we've done in the past, we know there's new needs now. And so we're putting new programs in place to address urgent current needs. We're trying to turn these around so that they're launched rapidly and as soon as possible. We've done a lot with trying to get formal, what we're kind of calling formal position statements, information where we, Cure SMA, have a stance, have a position on a certain topic, getting these into a format, on our letterhead with signatures, and putting these out ourselves to various groups, whether it's state Medicaid directors, governors of states, putting this information out, but also making it available to all of you, that if you need this information, if you need backup for a position, you can use these documents. And some of these are focused on, the importance, probably beyond, again, the general guidelines, being able to work from home, being isolated for that situation. School as well, the SMA families, patients are probably going to need longer than normal to be able to stay out of school. The importance of treatment urgency that we've talked about, that is not elective. And also, some certain ways that might make it easier for SMA patients and families to gain access to supplies, groceries, even things like that. We are going to be rolling out some programs as well to try to get some support through gift cards to everybody. We're going to try and focus there on providing resources that might help you stay in your home, but have access, again, whether it's Uber Eats, something like that. We'll try and roll something out to give support in that area. And then also, while it might be difficult for us, we're seeing what we can do to even get shipments out of physical supplies. Nothing critical medical here, but just general items that might help kind of in the household and things like that. We're pulling that together. It might be difficult for us with logistics. Are we able to get into our offices as essential employees and just, shipping supply chains if we're able to do that? But we're going to try something. We're going to try our best there to get that out and be bold and aggressive in that area. I did want to say something here as well, just to let everybody know that we are getting very good support from our pharma partners in the community. They're all very focused on what we really want them to be focused on right now, which is in their areas, making sure that we have safe, continued access to treatments and the clinical trials, that we're having these doses on time. They're working through their supply chains to make sure that happens and that we don't have shortages. They're working through the regulatory processes, and they're experts in those areas, and they're doing that. And so, everything that we have going on with Avexis, Biogen, and Genentech, they're focused on those areas where they know what to do, but they're also stepping up to support us as a community, as they often do outside of the treatment research area, to be partners in our community. And they're all offering us support to help out with a lot of these new programs that we're talking about as well, replacing summits and a conference potentially, and some of these new programs that we want to get put in place as well. So we want to go to the next topic. This will be the final one that I'll go over, and then we'll turn to Mary and saying as well, we're going to get to a lot of your questions that you submitted as well as we go through these, a lot of those on the medical side. I did want to touch on the advocacy area, and this is what Maynard will touch on, that we look at this at various levels. We've been very active on the federal level with some of the stimulus bills and those activities, being involved in advocacy there as our organization on behalf of the community. And we've drilled down at the state level as well. And again, we've actually already sent out letters to all of the state governors, all of the state Medicaid directors, focused on the issues that we've been talking about, making sure they know the position of our community in those. We do want to say as well, let us know about your issues, whether you see something in your state that concerns you, that advocacy might need to step in on, or here especially, if something does start to impact you personally, please reach out to us, let us know, and we will get involved. And so what we'll also do is we'll do this as Cure SMA, and as needed at the state personal level, we as a whole community will come together and we'll let you know when those opportunities come up. The final item I wanted to highlight here is an item that's bubbled up a little bit, and we're paying attention to it. There's some articles that have come out and some protocols that have been found that talk about potential prioritization restricting access to healthcare resources in emergencies. I think our approach on this is we think this is an area of concern, but not an emergency panic for us at this time. We haven't seen anything actually happen from any of these protocols to anybody in the SMA community. Any states have actually done anything in this area, but we saw some things coming out, Tennessee, Texas, I think there was another area as well, where things that were actually old and outdated protocols that would say pull resources away from a certain area in an emergency situation. They are old, they're outdated, and again, we haven't seen any of these put in place right now. So I think our approach was, these are really bad protocols. We don't agree with them. I'd say, in this area where we're talking separately about, there needs to be some flexibility on treatment timing. There is no flexibility from us, from our community on this issue, that some of these are discriminatory as they stand. And they're even out of date and inaccurate as well. When they talk about SMA in particular and not having treatments available, they're just outdated, old. And we've already stepped in to kind of go on record with the state. This is what we actually sent out to all the governors, and we've got these letters available for anybody as well. We really wanted to go on record as where we're going to stand if any of these protocols come into effect. We think that's probably the right position for right now. We hope that gives comfort to people as well, that we've gone on record, we're ready to move in this area. Nothing has happened yet. I think we believe these are just old and outdated, discriminatory things that will not get put into place. But we wanted the whole community to know we've already taken action, and we're here ready as well to really kind of step up if anything happens. So please, this is an area where watch, let us know if you see anything in your state for you personally, and we will step in very strongly. This is an area where we'll certainly put every single resource that we have to back up our position that we've already put out, that this is not appropriate. This is not something that we in the SMA community will stand for. So with that, I wanted to hand over. Mary, I believe you got the next slide. Do you want to take it from here?
Yes, thank you, Kenneth. Thank you, everyone, for joining us. Next slide. So I'm just going to jump right in so we can cover as many questions that you've submitted to us as possible. You are reading so much about the coronavirus, COVID-19. COVID-19 refers to the disease. Everyone knows the first cases were identified in China 3 months ago. It is a respiratory virus. It's actually a very simple respiratory virus, but is a very contagious respiratory virus. Transmission is by person-to-person transmission with respiratory droplets. And as everyone knows, the U.S. now leads the world in the number of cases of COVID-19 compared to other countries. The transmission rate is that every one person who has COVID-19, are infecting at least 2 others. It's not just exposures, but they're infecting at least 2 other people. Next slide. As Kenneth stated, our priorities at Cure SMA are your health, safety, and well-being. That really is foremost in our minds. And to meet those goals, we want to provide you with accurate and timely information. Next slide. Thank you for your feedback and guidance. Everyone has been communicating with us, and we so appreciate that. We've built this website on our homepage, which is at the top left. If you click on the circled area, that will take you to our resource page, our information center, where we've created letters and documents to help you with a variety of issues, including access to SMA treatments, continued schooling and working from home, continued use of in-home personal care assistance, as well as access to special shopping hours in your community. Many stores and grocery stores are offering elderly hours or hours for elderly people. Many of those stores have included people with special health care needs to also participate in those times. And I encourage you to explore with your local stores and grocery stores the availability of those. And you can find a letter on our website to support access to those hours. Next slide. I want to briefly remind the community about general recommendations related to COVID-19 and having SMA. As people with SMA, you are in the higher risk category when you go to the CDC website. Highlights of the things that you can read off the slide is that it is so important to continue your regular routine during this time. If you use a cough assist daily or twice a day, please continue. Do your usual routine. If you develop a viral illness, respiratory symptoms, go into your sick plan. If you haven't developed a sick plan, please do that as soon as possible. We recommend having 2 to 4 weeks of extra supplies on hand. So if you usually have 1 month, request an additional month. If you have state Medicaid insurance, some of the guidelines have been relaxed, and you may be able to obtain additional supplies sooner than usual. Maynard will talk shortly more about the advocacy that Cure SMA has done to support you during this time. We want to thank you for completing the community survey, which will be released shortly. Just know that we use that information to demonstrate changing needs and also to advocate on your behalf. If you must travel, travel by car. You have the greatest control over the situation when you're using your own vehicle. In addition to the cdc.gov website, also see your local or state public health department website for additional information. You will find the most information relevant to your community there. Next slide. The next several slides will go through many of the questions. We weren't able to get to all of the questions. Hopefully I and my colleagues are able to address many of the things that were submitted to us. This question is that we have a night nurse or other in-home care workers coming into the home. How do we protect the person with SMA? First of all, it is appropriate to ask the person coming into your home if they are feeling ill, if they have any symptoms, if they've had any exposures. In-home nurses should be free of symptoms and should not have been exposed to anyone with COVID-19. Consider providing a cover gown and also having gloves available in your home. If the person with SMA is ill, that person should wear a surgical face mask, or if that's not possible, the home care nurse should wear a mask with eye protection, a cover gown, and also gloves when providing care. Next slide. The next question is that one person in the household goes to work outside the home while others are home. How do we control exposure? We heard about this question very frequently in our community. Advice that's been provided to us is that some families have a transition space in their home, such as an entryway or mudroom or a disinfecting zone that is used to take off clothes after returning from travel or work, and to wash and they may shower before joining the rest of the family, as long as that individual is healthy. However, if the person who works outside the home has been exposed to someone with known COVID-19 or they are a healthcare provider, they should self-quarantine, staying at a part of the home separate from others, using separate drinking and eating utensils and dishes, and frequently washing hands. Clothes should be washed and dried in the hottest temperature tolerable for the fabric. Also keep in mind, don't shake out clothes. This can aerosolize the infection. If the individual feels ill, they should wear a face mask and self-isolate from the rest of the family. Next slide, please. We receive supplies, mail, and packages into our home. How do we manage? The virus SARS-CoV-2 has been demonstrated to survive on plastic and stainless steel for up to 72 hours. On cardboard, the virus is gone after 24 hours. For packages and supplies received in the home, we recommend wiping down with antibacterial wipes as feasible. It's possible to use gloves to open the package and then take out the items and wipe them down. And again, using common sense will be very important, but just keep in mind using your antibacterial wipes will be very, very helpful. The one thing about COVID-19, the virus is very susceptible, easily removed with washing hands and with the antibacterial wipes. The problem is that it gets spread before that happens. Next slide. I wanted to review isolation and quarantine procedures that are being recommended across the country. If you discover you're positive for COVID-19 or you exhibit symptoms of COVID-19, you should isolate for at least 7 days after symptoms start and isolate for 3 days after fever is resolved and breathing symptoms are nearly resolved. And it's the later of those two. If you're exposed to someone with COVID-19, then you must self-quarantine for 14 days. Next slide. How will quarantine affect Spinraza dosing? Quarantine may result in delay to being able to receive Spinraza. As Kenneth mentioned earlier, 1 to 2 weeks is not a problem, and even possibly up to a month. Typically, quarantine lasts for approximately 2 weeks, and under the circumstances, a delay of 2 weeks is acceptable. Next slide. My dose of Spinraza has been postponed. What should I do? Receiving Spinraza on time is a high priority, but there may be other complicating priorities that result in delays. We recommend that getting doses as close to schedule is important. A few weeks delay may not have a huge impact as there may be specific personal health status issues or local COVID-19 issues that could influence the timing. If your scheduled Spinraza dose has been delayed, please work closely with your healthcare provider team to reschedule that dose for as soon as reasonably possible. Please know that we do not recommend viewing Spinraza doses as elective or non-urgent, and dosing should not be delayed for a significant time. Next slide, please. What is determined to be the best course of action for those who will need Spinraza injections in the upcoming weeks? Is waiting 1 to 2 months reasonable in order to avoid going to the hospital? Waiting 1 to 2 weeks should be okay. Possibly up to a month may be acceptable depending on the needs of the individual. Don't wait until the next scheduled dose. If a dose is missed, it should be made up as soon as feasible. We do not recommend just skipping a dose. Next slide. I'm worried about exposure to COVID-19 if I go in for my Spinraza dose. Should I still go? This is a very frequent concern. My recommendation is that you work closely with your healthcare provider and ask questions such as how many people will need to see the individual receiving Spinraza? Can you avoid the waiting room and be placed in a procedure room as soon as possible? In collaboration with your healthcare provider, determine what the risks may be. Next slide. My child is scheduled to receive treatment with Zolgensma? Should I proceed? Similarly to our recommendations for Spinraza, receiving Zolgensma is a very high priority. Every precaution should be taken to avoid exposure to COVID-19. Planning to receive Zolgensma should include the same strategies that I just discussed, avoiding exposure to COVID-19, such as avoiding waiting rooms and being placed in procedure rooms shortly after arrival, and also limiting the number of people you are in contact with. Please, please, please work with your healthcare provider to schedule administration as soon as possible and to ensure safety to receive Zolgensma. We do not recommend viewing Zolgensma treatment as elective or non-urgent, and dosing should not be delayed for significant time. One thing to know with Zolgensma is that while taking prednisone or prednisolone, which can temporarily suppress the immune system, people should be considered at higher risk for serious illness from COVID-19 and should take all the recommended precautions very seriously. We are not aware of any specific information regarding COVID-19 among people who have received gene therapy, including Zolgensma. Next question is that I am not currently on a treatment, but I am working with my healthcare provider to obtain approval to start. What should I do? If you're working with your provider to start treatment, receiving an FDA-approved treatment for SMA as quickly as possible is a high priority. Continue to work with your healthcare provider to obtain that approval and scheduling dosing as soon as is reasonably possible. I wish to review the symptoms of COVID-19. You have all heard this, but just to review, typical symptoms may appear 2 to 14 days after exposure, and those typical symptoms include fever, cough, and having difficulty breathing. Symptoms that require emergency evaluation and probable hospitalization are if you have difficulty breathing, if your chest hurts or you experience chest pressure, if the oxygen saturations are low, or if the individual appears to have bluish lips or a bluish face, if they have difficulty waking. We have been asked to share information about others with SMA who may have had COVID-19. I've reached out to international colleagues to try to gather some information about people with SMA and COVID-19. Currently, there is essentially no information. We had one family who reached out to us. It was a young adult in their family, and they had mild coronavirus, and they are recovering well. No one in the family required hospitalization. One of the interesting things, though, is that the family reported sudden loss of smell and taste. And as I've been reviewing information, the sudden loss of smell and taste has been reported in association with mild COVID-19. Otolaryngologists or ear, nose, and throat doctors are reporting seeing patients with loss of taste and smell without other symptoms, and subsequently these individuals are positive for COVID-19. My advice is that if you experience sudden loss of smell or taste, not necessarily associated with nasal congestion, you should isolate yourself as someone who may have COVID-19. To get testing, please contact your healthcare team. Testing in the United States is still limited. Also, testing requires a physician order. Please do not order an at-home kit, as these are scams. Next slide. I've also received many questions about managing hospitalization. What should we do? The respiratory care guidelines for viral illnesses should be followed. The one thing is that when you have a respiratory illness and SMA, how you manage that does not change. It requires aggressive airway clearance with secretion mobilization techniques like chest physiotherapy or vest therapy or whatever technique that you use, plus using the cough machine. Breathing support for difficulty breathing and low oxygen saturations with ventilation using BiPAP with a backup respiratory rate. If you need to go to the hospital, you should take your respiratory equipment with you. And I had a question about ventilators versus BiPAPs. BiPAPs are different than ventilators, but just know that the Trilogy is a ventilator that can be used as a BiPAP as well as a ventilator, and that can be used in the hospital. Sometimes or often, intensive care units have their own ventilators, but under the current situation, I think we may get to a situation where hospitals welcome using your home ventilator just for support within the hospital setting. Take all of your respiratory equipment with you. And then after aggressive airway clearance and breathing support have been implemented, oxygen can be added if it's still required. One of the things, the respiratory complication that is being reported related to COVID-19 is that people are developing acute respiratory distress syndrome. ARDS is an inflammatory reaction in the lungs due to a lot of inflammatory mediators being released as part of the infection. Please know that the protocol for management of ARDS is ICU driven. That protocol will be very different than what you are familiar with. And just know that the ICUs are very experienced in managing ARDS. And I would venture to say is that many ICUs are much more experienced in managing ARDS than possibly spinal muscular atrophy. Please allow the medical team to help. In addition, nutrition and fluid management are also critically important during this time. I included a reference at the bottom of the page, which is a pediatric patient that we published a report about. It is only one patient, but the patient survived, and we wanted to share experience related to ARDS and SMA, and that was secondary to a different viral respiratory infection. Next page, or next slide, sorry. Are people with SMA being excluded from treatment if hospitalized? As Kenneth mentioned, this is a very concerning situation. To date, we are not aware of exclusions to care or hospital bed limitations. The shortages have been with personal protective equipment for healthcare providers in the hospital setting. I wish to thank you as a community again for completing the community surveys about how SMA is changing. Cure SMA was able to share that information with the states and strongly recommend reevaluation and revision of any triage policies they may have in place that may be discriminatory. SMA as a disease is changing dramatically and rapidly. And Maynard will talk more about this in a few minutes. Next slide. Should patients with SMA take a maintenance dose of hydroxychloroquine to prevent COVID-19? Hydroxychloroquine and chloroquine are medications used to prevent and treat malaria, and they're also used to treat autoimmune disorders. These medications are just beginning to be studied for possible use against COVID-19. Hydroxychloroquine was studied in a small number of patients in a randomized controlled study in China and did not find any difference in recovery rates between those who were treated and those who are not. Hydroxychloroquine used to prevent COVID-19 has been associated with a death in Arizona when two people drank a poisonous fish tank cleaner that contained hydroxychloroquine. 2 deaths in Nigeria were also associated with chloroquine overdoses used to prevent COVID-19 infection. I tell you this to caution you. Hydroxychloroquine side effects include headache, dizziness, nausea, diarrhea, stomach cramps, anxiety, mood changes, heart rhythm changes, and can interact with other medicines. Hydroxychloroquine is not approved for COVID-19 treatment or prophylaxis, and due to considerations to keep everyone safe during this time of great uncertainty and the lack of testing in people with spinal muscular atrophy, use of hydroxychloroquine is not recommended. Next slide. Are hydroxychloroquine and azithromycin helpful to treat COVID-19? There's one study in France that found that patients who took this combination cleared the virus from their bodies more quickly. However, additional studies have not supported this. Currently, there are multiple clinical trials that have started in the U.S., and we hope to get information soon. At this time, it is not recommended to use hydroxychloroquine and azithromycin outside of a clinical trial to treat COVID-19. Next slide. I wish to share with you new medical-based programs that Kenneth touched on. I just gave you a tremendous amount of information for you to digest. We will get to more questions later, time allowing. I encourage you to monitor our COVID-19 Information Center. We are adding new content to it every day. Please send us recommendations for things that you need to continue to survive well in the community. Let us know how we can help you. We plan to host a healthcare provider webinar in the next week or two. And just know that additional virtual information support is coming. Next slide. I will now turn this back over to Kenneth to continue. Thank you.
Thank you, Mary. So what we're going to do is turn a little bit now to more on the support area than just the care part. And so Colleen's going to go through some of the new programs that we're looking to put in place, again, replacing some that we've had to postpone, cancel, but also new programs to try and meet the current urgent needs. So Colleen, are you on?
Yeah. Hi, everyone. This is Colleen McCarthy O'Toole, and thanks for being on today. I just wanted to run through, as Kenneth had said, some of the new Cure SMA support programs in response to COVID-19. So some of these new programs include, our first program is going to be more information for newly diagnosed families. We want to make sure any of the families that are receiving their diagnosis right now are getting more information and more support. So we are providing more information in their information packets, additional emails to them, and additional outreach to all newly diagnosed families. We're also creating a new COVID-19 support package, which we're really trying to get implemented immediately within the next couple of weeks. This is going to be a really great package that's going to just contain some different helpful and needed items, as Kenneth had mentioned, such as antibacterial wipes, antibacterial gels. We're also looking at grocery store or restaurant gift cards, things like Uber Eats or Grubhub, Amazon, so that people can order groceries. So we're going to get all those items and try to get them out to families. There will be something for families to fill out on our website to receive one of these packages. We're looking at all different packages to include, such as even hand lotion. I know we've had a lot of families and people have said how dry their skin is now because of all the antibacterial gel that they've been using, and extra hand soap and those kind of things. Also items even to help keep the kids busy at home, since there are so many kids at home now all the time. So again, stay tuned on our website and we'll be updating that so that hopefully within the next 2 weeks, this will all be launched and ready to go. Next slide, please. We're also going to be establishing virtual Summit of Strength programs. As you know, we have now had to cancel many of our Summit of Strength programs in local communities. So we're trying to replace those right now with a series of webinars, which we're also going to be launching in the next couple of weeks. Some of these topics could be topics that are usually covered at our Summit of Strength programs, such as IEP and education or aquatherapy, some of the self-care and caregiver topics that we're working on, physical therapy, oral speech, transitioning, all of these topics that we're going to try to build into a series of webinars. The webinars could have one topic or it might have 2 topics. So we're working on those and we're going to get those launched right away. And then another new program that we're creating is virtual engagement. So we're looking at using different networking platforms to encourage the SMA community to network with each other. For instance, we're trying to create a program for newly diagnosed so that they now can talk and network with one another, as well as teens with SMA, a grandparent group. We're trying different platforms. We're looking at things like Google Hangouts, Skype, Zoom, or House Party. And so we're going to get that launched right away in the coming weeks as well. Over to you, Kenneth.
I think so, yeah. Thank you, Colleen. So we're going to turn to Maynard now, who's going to go over the advocacy items that we've already done, but also just kind of showing how we're going to be available as things progress, whether, again, it's new things at the federal level or as things drill down to local areas. Maynard, do you want to go?
Great. Thanks, Kenneth, and thanks for being on the webinar, everybody. So I'm going to take the next couple of minutes to highlight the federal and state responses to COVID-19, including the items that are related to the SMA community, and then briefly discuss the important role that we all have related to the monitoring of these government actions to this emergency. So let's go ahead and start with the federal government response. several key agencies, including CMS and the U.S. Department of Education, have issued specific COVID-19 guidance to clarify or to educate states on the delivery of service. For example, CMS has issued guidance on telehealth, encouraging states to use those technologies to deliver clinically appropriate Medicaid services. They've also released guidance on the emergency authority within Medicaid that gives states flexibility during COVID-19 to, for example, serve more people, increase services, and make changes in delivery of those services. Also related to SMA, the Department of Education has issued guidance noting to school districts that, for example, if they are providing educational services to the general student population during a school closure, that the school must also ensure that students with disabilities also have equal access to those opportunities. The department further clarified that it understands that school districts may not be able to provide all services in the same manner that they would typically do, but that the law does allow them to provide some flexibility in determining how to meet the needs of students with disabilities. The CMS and the Department of Education guidance can be found online on our COVID-19 Information Center that was referenced earlier in the webinar. And more generally, there is a great resource at www.usa.gov/coronavirus that outlines guidance and other FAQ information from all the various agencies across the federal government, including the ones I didn't mention. Next, we're going to move to Congress. We're going to remain on the same slide, though. So Congress, as you know, has been working really hard to respond to COVID-19. They have approved 2 packages so far that are now law. And last I checked, the U.S. House was still debating the 3rd package, which is more focused in on economic stimulus, and that is expected to pass later today and to be signed by the president. Let me just highlight 2 things related to those packages that may be of interest to the greater SMA community. The 2nd package of bills that were approved included a temporary Medicaid funding increase that gives states an extra 6.2% federal match to help cover increased Medicaid care, equipment, services, and therapies the state may provide during the emergency. And I'll touch more on that when we turn to the state advocacy efforts. In addition, let me just briefly address the education waiver authority that some have asked about related to its impact on the Individuals with Disabilities Education Act. As background, Section 3511 of the stimulus package, the one that is now being debated on the floor of the U.S. House as we speak, it gives the Secretary of Education a temporary emergency authority to approve local school waivers related to certain elementary and secondary education requirements. Within that section, Congress did build in several safeguards into this broad authority. One, this authority is temporary, and it is not to exceed the 2019-2020 academic year. 2, the Secretary is prevented from waiving civil right requirements. And thirdly, the Department of Education must notify Congress within 7 days of approving a waiver. That said, Section 3511 does require the Secretary of Education to report to Congress on any additional waivers she believes are necessary for states and local educational agencies to meet the needs of students during the emergency, including waivers specific to the Individuals with Disabilities Education Act. While this bill was under negotiation in the House and Senate and between the White House, SMA wrote a letter to Congress raising concerns with this provision. However, now that it will soon become law, our role now will be to closely monitor this and to track any waivers that they may seek. In fact, SMA was just invited to attend virtually a meeting on Capitol Hill this afternoon that we will attend on this very topic. Our goal, of course, will be that making sure that the educational needs of students with SMA are met, even under these very unique and emergency situations. I'll next turn our attention to the states. SMA has been especially focused on the work of states related to Medicaid, which, as you know, is a major provider of home and community-based services and supports for people with SMA and other disabilities. Every state now has discretion on how and if to use the extra Medicaid funding and flexibility that I had referenced earlier. Our goal at Cure SMA is to make sure that the Medicaid-related needs of the SMA community are being met. As such, and as Kenneth mentioned at the very beginning of the webinar, Cure SMA did work to contact every single Medicaid agency across the country earlier this week to ask that they expand eligibility, availability, and scope of Medicaid waiver services to prioritize care and support for the SMA community. Those letters can be found through a link on the COVID-19 information page that was referenced earlier. In addition, you can find a Medicaid template letter that you yourself can download and to tailor to address to your Medicaid contact or the Medicaid state agency director to highlight your own concerns or care requests to your Medicaid agency. Cure SMA wants to be a true partner with you in this effort, and so please copy us on those letters and update us on your activities. Just as an update, I was just checking just moments ago, states are beginning to take advantage of this emergency authority and are acting on these 1315 waivers. So based on that last check, CMS has approved about a dozen of these state emergency waivers, both in the east and the west and the middle part of the country, and we'll likely see more of that in the coming days and weeks. We've also heard from some states in response to our SMA-specific letter. Continuing on states, let me also address the issue that Kenneth mentioned that there's concern about rationing of care and scarce equipment resources during an emergency. The issue of emergency care policies surfaced recently in a New York Times op-ed and through other outlets. The articles point to certain emergency policies that single out individuals with SMA as being a population that could be excluded from hospital admittance or for equipment in a public health emergency. As Kenneth mentioned, these written policies that we've tracked back are dated. Some of them have been written back in 2014, 2016, and so again, this was done in advance of the current COVID-19 situation. Regardless, these policies are medically inaccurate and just wrong, especially in singling out the SMA community as having limited benefit for healthcare and other supplies. We all know that is far from true, and so Cure SMA has responded, as Kenneth mentioned. Yesterday, we sent letters to all 50 state governors to educate them on exactly what is happening in the SMA community, all the positive changes, and also asking that as chief executives of their states that they take two immediate steps. Number one, they should rescind these inaccurate and misguided policies. And two, they should notify healthcare providers in their states of their action and to ask that medical providers instead prioritize care and supplies for individuals with SMA. Copies of those letters can also be found on our COVID-19 Information Center page. Let me close by saying that we are all in uncharted territory. This emergency and the responses are new for everyone, including Congress, the administration, the states, and of course, each and every one of us. From an advocacy perspective, it is our role to closely monitor and engage on these issues, particularly the resources and the new provisions that are being implemented or discussed, to make sure that they do benefit and not harm the SMA community. So please continue to update us on what you are experiencing and seeing locally, especially the challenges, so that we can consider ways that we can advocate on your behalf and with you to advocate for change and to raise awareness. And we will be sure to inform and engage you when issues arise that we can engage the entire SMA community on federal or state issues. With that, that concludes my presentation, and I'm going to turn it back over to Kenneth.
Thanks, Maynard. So what we're going to do now is we're at the end of kind of the hour that we set up, and we were going to move to a Q&A session, but we wanted to let everybody know we've hopefully covered a lot of the main issues, key questions, general questions that we've seen so far in the community. And we know everybody's really busy. So what we are going to do is we're going to have the slides available from this webinar. We have a recording as well, and we're going to turn that around as quickly as we can and get that available for anybody if you need to refer back to what you've heard so far. What we want to say, though, is we know everybody's busy and you've got other things to do. So feel free at this point to kind of leave the webinar. But what we're going to do is try to keep going a little bit with some of the questions that were sent to us in advance. Again, we hope we touched on most of them, but we want to go through a few more. And maybe if there's been a few that have been submitted live while we're online. So we're going to keep going probably for another 15, 30 minutes. This also is going to be recorded. It'll be available for later. But please don't feel like you have to stay on at this point. We'll get to kind of some more, other side issues that we've seen coming up, and we'll try and address them. But they'll be available for you later as well. I'll also say that we are going to be obviously watching this situation change day to day. We'll be doing other webinars. We'll do another webinar like this. One if it's needed just for repeating the information, or if we see things change. And even if it's next week, if we've seen the situation change, we'll do another one of these. So just at that point, I just want to say thank you for everybody joining us. Thank you for all you're doing, keeping this whole community strong and healthy. And what we'll do here is we'll just try and get to some of these specific questions that have been submitted to us. So with that, Leslie, do you want to take us through some of the questions?
Sure. We can get started with the Q&A. And again, these are questions that were submitted in advance of the webinar. And we'll make sure, as we've said several times, that the information center is updated, and we'll include another Q&A that includes these questions as well. I'm going to start with a question I'm going to start with a question that came in online, and it says, if our SMA family gets hospitalized, are we able to have family members stay there for the care? And so I'm going to pose that one to Mary, if she doesn't mind answering.
Yes. The answer is that please talk to your healthcare provider team. Every hospital is trying to control exposure to COVID-19 as much as possible, and they may restrict visitors. However, I encourage you to advocate for the need to be present with your family member. And for those of you with SMA, that you advocate to have someone with you. We will develop a supporting letter or document that you can download and use if there's difficulty, just stating the importance of having a family with an individual in the hospital. Thank you.
Great. So a question that we actually received from several folks about school and work. Is it safe for me to go to work or school?
I think everybody across the country is currently in lockdown in one form or another. But we need to plan for when we're able to come out of this. Just know that right now we recommend that everyone go to school and work remotely. And when we get through this pandemic and people are able to start going back to work, we anticipate that the SMA community will be later in returning to the workplace and returning to the public. And we have documents online at our information center to support that. Just know that there are regional differences in COVID-19, both in the incidence of infection, where urban areas are at highest risk because of population density. And there are also differences in access to testing. So I know that as a medical professional, I'm not 100% confident that the reports of the number of positives is fully accurate. It gives us definitely something to monitor and an estimation, but it's not fully accurate. So continue to watch the numbers. Cure SMA will continue to monitor what is happening across the U.S. and try to provide guidance about when it may be safer to go back into the community, back to work, back to school. And just realize, again, that there may be regional differences in ability to return. Thank you.
And if we lost Leslie, I think we might have been having some problems with that. So maybe I'll kind of...
Sorry.
Are you there?
No, I'm so sorry.
Okay.
The next question we got was related to clinic visits and whether it's safe for someone with SMA to continue attending their clinic visits.
Much of the SMA community healthcare providers are transitioning to doing telehealth. So it's really important for you to continue to work with your healthcare provider about which clinic visits require you to be in person and which ones can be managed remotely. Healthcare teams are really thinking creatively, using phone check-ins. They're thinking about avoiding time in wait rooms. Some centers are having days where only healthy people can come into the clinic space and other days where only people who are ill come into the clinic space. So again, work really closely with your healthcare team about what is the best option. Thank you.
Great. Will getting the pneumonia shot or influenza shot lessen the effect of COVID-19?
So I encourage everyone to get the pneumonia shots, Prevnar 13 and Pneumovax, and also to get the annual flu shot. These will not impact the effect of COVID-19, but they're important in order to avoid having other complicating infections. Thank you.
Great. That's very good advice. Our next question comes from those who are in the younger demographic of our community. It says, what does our community make of the fact that people under 20 appear to be less impacted by COVID-19?
So this has been an interesting observation. In some ways, we can be cautiously optimistic, but just know that we're also hearing reports of younger people, young adults, these are people over 20, that are being hospitalized with severe disease. I am cautiously optimistic. Do not let up on everything that you're doing for isolation. I think we will learn a great deal as more time goes by regarding COVID-19 and its impact on various subpopulations, such as younger people, people who are pregnant, people with special underlying health conditions such as spinal muscular atrophy. But at this time, I maintain strict isolation to protect yourself. Thank you. Leslie?
I apologize again. We've heard about this a bit throughout the webinar, and people are looking for a comment on how we think that hospitals are prioritizing patients' care, and should we be concerned about the protocols that are excluding SMA patients from this critical care?
As Maynard said earlier,
first.
Oh, sure.
Mary, just to reiterate. So I think, again, that we haven't seen any of these protocols actually getting implemented. We haven't seen these being put into effect. So I think our position, again, is they're very concerning. We don't like those policies, but we see them as out of date and they're not being implemented yet. So it's more, I think, for the community, we say, be aware and watch for these things. If it happens in your state, if it happens to you, let us know. We think hopefully we've kind of gone on record enough and we've escalated this to a high enough level with the governors, as Maynard was saying, and now we're ready to step in. So be aware, but we don't think this is something to be really concerned about right now. Mary, does that sound the right way to approach it?
Absolutely. If you hear, we are doing everything we can to advocate that this not be the situation. And similarly, this next question is, can a hospital take a home ventilator from an individual and give to another? And how is QRSMA getting involved on a state-by-state basis to not allow that to happen? I have not heard of that happening. I, as a medical professional, don't see how ethically that could happen. If you hear of this, please let us know, and we will intervene, advocate as much as we can. That is not a typical practice. And a hospital will not take a home ventilator because that is totally managed separately from what happens in the hospital is managed separately from what happens in a home situation. But again, if you hear things, please share.
Thank you, Mary.
Thank you.
I think this last question, we'd love to just hear. A lot of folks have been talking about this being the new normal. And so what will life be like after COVID-19? And is this the new normal for the SMA community?
And so maybe I'll take it first, just our thoughts on this one, and then Mary as well to jump in. But I think this is kind of my viewpoint on what I see happening here is I think what we're going to see happen is the procedures, the protocols, the things that the SMA community, as we've been saying, always have been doing with isolation and hygiene practices, that's now going to have to translate over into the general population out there. And so the bigger changes are there in the general population. And I think that's going to take some time, obviously, as well, with kind of vaccines coming in, immunity kind of growing up in the general population. That's going to happen. It will get there. It's going to take some time, but eventually this situation will get stabilized. So things will take a while, a little bit different in the general population. But I think for us, we're probably thinking that inside the SMA community, not right away. And again, we're probably talking even next season, things will get back to what we've always been doing and the way that we always approach flu infection seasons. So I think it will for us in the SMA community. It'll take a while though. Mary, how about you? Do you want to share your thoughts?
Yes, I totally agree with you, Kenneth. I look forward to us being able to safely gather again as a community. And the good that I hope for from this entire situation is that everyone who doesn't have SMA or who is not impacted by this by SMA will be more aware of spreading infection and more respectful of space and infection control practices that you all are currently doing. Thank you. Kenneth?
Yeah, thank you. I think we're pretty at the end of just seeing Leslie. Were there any other questions submitted live that we want to take?
Nope, I think that was all we received live. And again, we received questions and we're going to take those questions and turn them into another Q&A that we'll post on the information site. So folks can share their questions, any additional questions with their post-webinar survey. And we are happy to add those to the Q&A that we'll be posting early next week.
Great, thank you. So just wanted to say thank you to everybody for joining us now, and watch for next week. We'll be doing more information sharing, but also launching some of these new programs and really kind of getting things out as quickly as we can to support these new urgent needs. So thank you. Thank you again, everybody, for joining us.